Hello, and welcome to Diagnosing the Barriers, the Right to Health in Israel and the oPt, a podcast from Physicians for Human Rights Israel, or PHRI. I'm your host, Natalie Foster. PHRI is an Israeli nonprofit organization that promotes the right to health for all people living in Israel and the occupied Palestinian territory, or oPt, through the direct provision of medical care and policy change efforts. Today, I'll be speaking with Asiel Aboras about the devastating impact of the Israel-Gaza war on the healthcare system, how military aggression and increased violence, both in Gaza and the West Bank, have exacerbated the system's pre-existing challenges, and we'll try to look ahead to days after the ceasefire hopefully enters into force. Asiel, thanks for joining me today.
Hello, thank you for having me.
So before we dive into the war and what's happening now with Israel's assault in Gaza and the increased violence in the West Bank, I think it would be helpful to have an overview of the health system and what it was like prior to October 7th. Can you talk a little bit about the state of the healthcare system and the oPt previously?
Yeah, thank you for opening with that. I think it's very important to, before diving in, the current war, the aggression on Gaza, the healthcare system, we've been hearing constantly on the news that the healthcare system is on a brink of collapse, mainly in Gaza, but even prior to the current war, the healthcare system wasn't fully functioning. To start with, if we want to look at the occupied Palestinian territory, the healthcare system is a fragmented system where it's not working as a sovereign one unit throughout the whole oPt. So the main reason for that is the blockade over Gaza. And of course, all of the Palestinian territory have been occupied for more than 55 years, meaning that there is a blockade, there's occupation, there's checkpoints from hospitals to hospitals, and it limits the mobility and the movement of patients, doctors, medical students, medical equipment, pharmaceuticals. All of it is under the Israeli control. Any movement from Gaza to the West Bank, but also the West Bank, meaning that for patients to move to East Jerusalem has currently the most developed hospitals. So for patients, they need Israeli permit. We've documented the illegal permit regime for more than 2 decades, and this is of course, illegally by international law, but also the decisions are very arbitrary, and the main argument is security. But several times we've showed that even when no security reason have involved in, for example, in a denial of a patient, of an ambulance, of a doctor, still their movement was denied or delayed. It's not just controlling the movement, it's also limiting and controlling other economical and social determinants of health. For example, it's limiting the permits to build new houses, hospitals, clinics, schools. There's limitation on ambulance movement. We're hearing about it in Gaza currently, but it's have been a constant limitation throughout the years of the occupation, limiting access of ambulances, for example, from the West Bank to East Jerusalem. Sometimes patients need to move from one ambulance to one ambulance because the ambulances in the West Bank cannot go to East Jerusalem. So there's a procedure that is called back-to-back, where the patient need to go to an Israeli ambulance to access East Jerusalem, which is Palestinian territory. It's just annexed by Israel. If we're talking about determinants of health, violence, of course, is a big determinant that Israel basically using. This current aggression on Gaza is not new. It's just that the scale and the scope is much bigger, but it's not something new. There have been repeated aggressions on Gaza, and the healthcare system is a target. Not just the hospitals, but also doctors, ambulances.
And so you started to talk about the aggression currently in Gaza. And so I'd love to get into some of the specifics about the physical attacks and the military attacks that are happening on hospitals in Gaza. If you can talk about that a little bit.
Yeah, we're now 6 months into the war. The amount of airstrikes and bombardments on Gaza have been unprecedented. And a big amount of it is targeting hospitals, targeting the actual buildings of hospitals, the ambulances, the roads that lead to hospitals. From the beginning, the first few weeks of the war, the Israeli military have issued evacuation orders to the hospitals, mainly the biggest hospital, for example, Al-Shifa and Al-Nasser Hospital. WHO have called this evacuation order as impossible. There's no way that you can evacuate a hospital and the doctors in few hours or even few days, or
Right.
Like it's an impossible mission. You are talking about wounded and sick people who are connected to machinery,
Yeah.
and they're not mobile.
Right.
Sometimes they cannot move.
Right.
And of course, with the beginning of the war and the unprecedented bombardments, the first instinct of people is to go and find refuge in hospitals, because people think that hospitals are protected. They have resources. They are big buildings where people can actually seek refuge. And usually, it's the last place with fuel, running water, who still gets food. It wasn't the case. We saw in this current aggression, hospitals are not protected. They are a target. Israel have been using hospital and the healthcare system as a weapon. They have, even if a hospital is protecting 50,000 displaced people who went there because they were seeking protection, they still or issued evacuation order. They still bombed the area of the hospital. Sometimes we've heard from also reliable sources that there were sniper shots to the hospitals, even to the operation room. In one of the cases, we heard that a nurse was killed inside the room. So this is the physical targeting. Of course, all of this is causing trauma, not of course on everyone, but also on doctors and physicians and nurses who need to operate, who needs to work in a dire situation where without electricity, we've seen pictures that they are operating only with the light of the flash of the phone. We've heard stories that doctors had to amputate patients without anesthesia or painkillers. Oftentimes, especially children, even died after this kind of operation from pain.
Yeah.
We are in 2024 and these things are happening. The reasons for that, of course, the targeting of the hospitals, but also the limited access to aid. We've talked about it in previous episodes.
Yeah.
Israel have been blocking, basically a total blockade on Gaza, and no medical equipment were entering. It put doctors in a situation where they have to operate with minimal equipment.
Yeah.
And this is tragic.
Yeah. It's like strained an already strained system and rendering it almost unfunctionable. And just out of curiosity, when there were evacuation orders, did people leave, and where could they even go? Because I know that there are like only a third of the hospitals in Gaza that are still working. They're at a level that are not able to care adequately for patients. So where are they expected to go, or where did they go in cases where they were evacuated?
Yeah. So Israeli army issued these orders without even giving a plan or a secure passageway or a secure safe corridor for these patients to move. We've many times we've asked that. First of all, this you should not ask hospitals, but if you already do, you should secure a corridor. You should secure a passageway to get to another hospital. But the thing is, when all of the hospitals are already functioning on 200% from their capacity, there's not enough beds to accommodate the sheer number of who needed sick. You cannot just decide or order one hospital to move to another hospital. when the amount we're talking right now on over 80,000 people who are wounded from the war. Of course, we're not even talking about people with chronic diseases who need their usual treatment, like cancer patients, for example. The hospitals are not, as you said, they're not functioning properly. There are currently only 6 hospitals in the north and 6 hospitals in the south that are functioning, but it's partially, meaning that they can only give immediate care and treatment for patients. They cannot take care of any further more than just the emergency current needs of the patients. And in many cases, doctors are put in a situation where they need to choose who is more critical, who they need to take care more of.
Right.
Doctors should not be put in the situation where they need to choose between these critical cases.
And you mentioned about the individuals in Gaza with chronic diseases and the inability to receive treatment that they need for the health issues that they had prior to the war. So can you talk a little bit about how the current state of the healthcare system has impacted health issues that were already existing in Gaza?
So as I mentioned, the healthcare system in all of the occupied Palestinian territory has been in a dire situation even prior to October 2023. It has been under chronic shortages of medical equipment, medicine, doctors, specialty doctors, infrastructure. The Gaza Strip hasn't been able to, even before October, it was in a very dire situation where it wasn't able to take care of chronic diseases like cancer. And oftentimes those patients needed to get to access treatment. They needed to go out of Gaza to the West Bank, mostly to East Jerusalem, sometimes to other countries. Like before the war, they had to issue a permit, Israeli medical exit permit, approved by Israel. It took months to get this permit. Sometimes they are denied. The situation has just been even more difficult because these patients cannot leave. There is evacuation list right now for countries. Like even this just take months, and those patients need immediate care. They need their usual treatment like chemotherapy and radiotherapy that they cannot get in Gaza, let alone that Israel has been bombing the only cancer hospital in Gaza. So whatever treatment that was available is not available anymore. People who need the dialysis, they cannot access it anymore. Any patient with chronic disease, they don't have the adequate treatment that they need, especially that chronic disease. We know that they need, they don't go to the hospital and get their treatment and that's it. They need constant checkup. They need to always see their doctor. They need to consult. They need, and it's not available. The hospitals and healthcare system in Gaza right now is giving not a quality treatment. It's just immediate, let alone, of course, on the public health crisis that is happening right now. There are a lot of diseases that in a usual situation, they're not supposed to be critical or not supposed to be, hard to manage. Like we've been hearing about hepatitis A and a skin rash and chickenpox. Those cases I want to say usual time, not in a wartime, they're not there. You can manage them with vaccines, with with pills. You can manage them. But right now, because of the huge amount of displacement, they are sheltering in tents, in UN shelters. They are crowded, hundreds of people using one bathroom. There's not enough sanitation and wash infrastructure. Because of that, these diseases are becoming deadly, especially for people who have been, for example, with chronic diseases before, who have had weak immune system before. For kids, for example, this is deadly for kids who are not getting their vaccines. It's super hard to manage vaccine campaigns right now. And to elderly people, it's becoming super deadly. People are dying from that. The numbers are just getting higher and higher. And one point that I wanted to mention also is that people are not. It's not just that they're not getting their medicine; they're not getting food. We have right now 1.1 people are under famine in Gaza, meaning that their bodies are deteriorating. They have weak immune system, so they are more prone to these kind of diseases. And of course, the cold. It's winter right now in Gaza. People are cold. Their bodies are weak. They don't have adequate shelters.
Right.
And when we say shelters, people think that it's a building or there's like it's able to give the basic needs. But when we say shelters, is usually a tent that a whole family is sleeping there, usually on the floor, with not enough blankets or warm clothes, sanitation, hygienic products for women. It's all of it is just inaccessible and limited if it's accessible. And Israel is continuing to close the borders, to limit and to delay aid. It's not just that of course, it's deadly and hard as it is, but it's also putting more weight and on the already not functional healthcare system.
Right. Yeah. No, absolutely. It's worsening something that was not strong to begin with. And so I would like to shift focus to look at the West Bank, because obviously the situation in Gaza is incomprehensible and has gained a lot of attention in the media. But the situation in the West Bank has also escalated drastically since the start of the war. So can you describe a little bit about what the situation there is currently?
Yeah, you're right. People, because of the unprecedented destruction and annihilation of a whole population in Gaza, people tend to, I don't want to say look away, because people are looking, but tend to forget that the West Bank is suffering from not similar but unprecedented amount of violence from the army and from settlers, either on the villages or on the cities or even on the hospital. There were numerous cases where the Israeli army raided hospital. There was a case in Jenin where the army raided a hospital and killed 3 people inside the hospital. One of them was a patient. We're hearing that from people in the West Bank that they haven't witnessed such segregation since the Second Intifada. The whole of the West Bank is super segregated right now. There's checkpoints. Their main streets are closed. It's super hard to move from one place to one place. So when we're talking about ambulances and patients and doctors, it means that if, for example, the road or the way to a hospital should take 20 minutes, is taking now hour and a half to get there. We've heard also from doctors for example, in the north of the West Bank is even more difficult. So the area of Tulkarem, Nablus, Kalkilie, and Jenin, of course. We've heard from doctors that they're seeing less patients. Less patients are coming because of the closed roads, because of the violence. Some people are afraid. They're just afraid to get out of their houses, especially if they're living next to settler outposts. Settlers are also getting, they're backed by the army. We've heard about the huge amount of settler violence that have been happening. Communities have been forcibly transferred because of this. More than 400 people were already killed. This is a huge number. And this all is affecting health, not just the hospital, but people's health, the mental health, the well-being. People are not able to access sometimes adequate food supplies and water. For people in area C, the situation is extremely difficult because they're living already in isolated areas where anyways the water is hard to reach there. So right now, with all of the violence that is happening and the violence of settlers, main streets are blocked, meaning that their access to water, to medical care is blocked. They are afraid to go to clinics, to hospitals, mobile clinics. So as you know, because the healthcare system is very, very dire and very was also very limited, and in a chronic shortages even before October in the West Bank. So mobile clinics are operating in the West Bank to give access to people who don't usually have access to medical care. And even these mobile clinics have been limited to some communities because there's closures. For example, in Hawara, a village who have been suffering violence and raids even before October, have been totally under closure for days since October, meaning that women cannot access healthcare, children, elderly, chronic diseases. We operate in PHRI, a mobile clinic that visit villages and cities in the West Bank that don't have access to medical care. We've heard in Hawara from women that they created some kind of shift to visit pregnant women because they cannot call ambulance whenever they want. So if an emergency happened or if a pregnant woman needs to give birth, they created a shift where at least few women need to be awake, and they will go and accommodate for her, and she will give birth in the house. This should not happen in 2024. And the fact that this is all happening at the same time, also in Gaza and also in the West Bank, just...
It sounds, I mean, it's like this overarching like system of control.
Yeah.
That in both situations, there's limited access, there's limited supplies, and the war has just worsened the conditions that
already were
already not suitable for living, essentially, and providing healthcare adequately for people to live a full life.
Yeah.
So in closing, I'd like to try to like look a little bit towards the future, as difficult as that is. We're really waiting for a long-term ceasefire to be announced as we're speaking now, days after the UN Security Council passed a resolution calling for an immediate ceasefire in Gaza. We know that this will only be the beginning of an immensely challenging reconstructive process. But so I'm hoping that first you could talk a little bit about what the implication of the UN resolution would be, and then what do you think a day after a ceasefire looks like, specifically trying to rebuild the healthcare system in Gaza?
Yes. So we welcome the new resolution. We think it's not enough. We need to see action happening, an action that is actually stopping the war and feeding the hungry people, and for more aid to come in. However, this is, even if it's not strong enough to end the war, it is good for diplomacy efforts. And we see Western countries look at the UN as their moral compass, and we hope that this resolution will mean that more that Western countries, democratic countries, will implement this resolution, the ceasefire, in how they're interacting with Israel and their foreign policy. So even though it was late after 6 months, it's good that it's happening. Now, regarding the rebuilding of Gaza, it's a very long road, but it's a road that we will need to go through. One of the first thing that should happen is that it should open the borders, all of the borders, not just Rafah, but also Erez. More aid should come in. Western countries will need to give a huge aid package once again to Gaza to let patients who are currently unable to get their treatment in Gaza to get it somewhere else, either in Jerusalem, Israel, the West Bank, or other countries, with the guarantee that they will come back. This is very important. We should get a guarantee that those patients who are also they're currently outside, or that they will go out after ceasefire, that they will come back, for all of the displaced people to go back to, not just, of course, there's nowhere to go back to. All of the houses have been bombarded, especially in Gaza. 70% of houses have either were totally destroyed or affected. So everyone should, displaced people and patients should go back to adequate, not tents. We don't want to see we don't want to see another Rafah in the north of Gaza, not to tent cities, but to adequate housing. The hospitals should go back to functionality. And for the future, I think Western countries should really voice out how healthcare system should not be a weapon. It should not be a target in their wars. Public health should not be a weapon. And there's a reasons why hospitals have special protection under international humanitarian law. We should guarantee that should be the case in the future. Hospitals, ambulances, medical facilities should not be attacked. Should not be a target. Should not be a target for military usage. And if we don't want for that to happen, there should be accountability. Western countries should end Israel's decades-long impunity, and for that we should see some accountability over its aggression and war of destruction on Gaza's civilians.
Yeah. I want to just echo that, your sentiment about healthcare not being a weapon. It feels like it's being used as a pawn in a long-term game by Israel, and health is a basic human right and should not be used as a means of war. So thank you very much for giving such a thorough overview of what's happening and describing a system that truly is on the brink of collapse. And hopefully a ceasefire soon will just be the beginning of a long road of rebuilding. So thank you for joining me today, Asil.
Thank you.
If you are interested in learning more about the destruction of the healthcare system, you can read PHRI's position paper on our website. As always, you're welcome to email with questions or comments to mail@phr.org.il. Thank you very much for listening today, and we'll see you next time on Diagnosing the Barriers.